like to welcome you to this episode of the podcast. And our guest today is Islaha, who is a final year medical student in the prestigious Bayero University, Kano. She is a very bright student and she has so much interest in helping the community. And today we'll be talking about her journey and some of the things she have inspired and how she have been managing in between her studies and the philanthropy stuff she's been doing. So I would like to formally welcome you to the program.
Thank you.
So first of all, we would briefly talk about your medical journey. We would like you to share a little in brief your background and what inspired you to pursue medicine.
Oh, thank you for having me today. Well, like you mentioned, I'm Islaha Yusuf. I was born and raised in Kano. Had my education in Kano, right from primary school till date. I'm still a student in Kano. Well, about what brought me to medical school, I would say destiny brought me here because I've always thought I would be an engineer, particularly a civil engineer, because of how much I enjoyed further maths in school, how much I enjoyed calculus, to be specific. So I thought that would be the business of the day for me. But here I am, thriving, alhamdulillah.
Thank you very much for that brief background and reasons why you pursue medicine. It's nice to hear that you kind of have a passion in civil engineer before this. This is what most people used to have. So, can you share some of your key moments? You've been in the university for a while, level 1 through to level 6. Would like to hear some of your interesting milestones in the academic journey.
Well, the journey hasn't been an easy one, but alhamdulillah, through prayers and support, it has been doable. I think that's what I would say. Support from friends, family, and the amazing family that I got in medical school from my class, the prodigies. I would always be grateful for being amongst them. My seniors, all of them, right from all the ones that I've met a very long time ago, they've made a great impact in my journey. And my juniors also, all of them, I feel like medical school give me a family. I made another ecosystem, if that's what I'll call it.
That's nice.
People that actually go through what you've gone and people that actually understand what it means to be there. And also, my lecturers have also been a huge part of this journey. The mentorship, the guidance, the, passive counseling and teachings that they even do without realizing, by the way they carry themselves, the way they teach, the way they, react with us that are the juniors. You feel like these are people that have attained something in life, but then they treat you as theirs. They treat you as someone that is important. And it's kind of very inclusive to actually be in a place where you feel like you belong.
Wow. That's this is very nice to hear. It seems like the whole journey have been interesting for you.
It actually has been an interesting journey, so much that I can say if I would be asked to choose where to go again, I would choose medical school.
That's great. That's great.
It's been tough, but I don't think I would have done any other thing if not this.
That's nice to hear. So the next we'll be going to the section of the philanthropy. So I would like you to briefly tell us, there have been so many projects you have been involved in. So I would like you to pick some of the few ones and tell us some of the projects you've done or you have been involved in and the impact and their impact.
Okay, so I think before I talk about this, it would be maybe to digress a little bit and talk about how this whole journey came about.
Yes, it's nice to hear about that.
Well, alhamdulillah, like I said, in all aspects of life, I've been blessed with beautiful people around, supportive people,
yes, and
good people that have actually helped to shape your mind into being what you are today. So I can say the philanthropic journey began from a very young age.
Wow.
You know, you see somebody and you decide to give the last thing you have and all those kind of things without thinking twice about it. You know, the family background where, you know, you're always taught to always give.
No.
Yes. So I think that's where it began. But, well, maybe as an older person, maybe a young adult, maybe let's say 18 years, I was opportune to have a best friend, couple of really fit friends that came together and involved me in an initiative.
Wow.
That is still aiming at giving back to the society. And the interesting thing about that is it's just a group of young chaps, just like me, about the same age as me, came together, put up that plan. It started gradually, like, you know, thinking, okay, can we work this thing out? Can we not? And we started Nurul Islam Foundation.
Wow.
That was in around, if I can remember, almost 4 years ago now. They're about maybe 2019. I'm not so sure.
Okay.
It's been quite long. And alhamdulillah, we've done, well, I won't say a lot, but at least we tried. We did Ramadan projects.
Wow.
We still do every year. We've gone to Islamiyas, distributed books. A lot of things here and there. Time would not permit to mention them.
This is inspiring.
Secondly, when we moved to the clinical side, still a couple of my classmates and some of my juniors, we came together with the help of one of my classmates who is a very visionary person, if I would say, Muhammad Abdul Mumin.
Okay.
Who felt the need for young minds to also come together and try and see how they can give back to the society and maybe try to create something like Mayo Clinic.
Wow.
In the near future or in the far future, we never can tell.
Yes.
And well, it's a small project that has also tried to give back to the society in one way or the other. And it's still running, and we're hoping that something good comes out of it in the future, inshallah.
Sure.
Then, when my own personal journey, I would say, began as, would I call it an experiment? In 2020, 2020 to be specific. I was in front of the male surgical ward. I was approached by a woman with her child who appeared to be not in good shape.
All right.
Yes, I think that would be a milder word
Yes.
to use for her condition. So it was, what would I say, an intuition that led me to try and find out what that woman was going through and try and help, even though I didn't know how. So I thought, okay, what do I do now? I actually just collected her number and told her that I'll try and contact her in the later day. So, knowing that I have good people around, people that have always been supportive, I said to myself, okay, let me just post this out on my social media networks and see how well would I be able to help this woman. And that was how I was able to gather some money from people, and we got her the medication that she needed and even more. Until date, that very woman, we're still in contact and we're still trying to sort her out. You know, life is not easy.
It's not easy.
Yes, with all the economic hardship and what have you, you know, things keep going left, right.
Yeah.
And sometimes it's up and down. But alhamdulillah, after her, I had a couple of people like that, and we tried to sort them out. And alhamdulillah, in most cases, we were able to. So it was through that people started reaching out to me on how to help people. And honestly, I haven't really made that personal work or personal projects rather into an official entity. But I'm hoping maybe in the future I do, or I was hoping I did, until the patient aid committee of my class came about, which is actively running also. So if you look at my journey, it's not about me, it's about the people around me that have actually made it possible. I feel like I'm just a channel to make those things happen with the help of the Almighty. But it's not my job. It has never been my job alone. And I'm grateful that the people around me have actually made this possible. Because if you look at me, it's not like I have any source of income or, you know, but it's just that people get help through you. And for that, you should be grateful.
So, to be frank, I'm really inspired, and because it's so beautiful, like the whole story you gave, and like you have been in the center of the people. Like it's just like God have really brought you to really be there for people, and that's nice to hear. So, in few words, can you just something like a form of motivation? Importance of giving back to the community. Importance of giving back to the community as a medical student.
Well,
like in form of a motivation which you give to the juniors.
Well, I think motivation. Once you are a medical inclined person, and you're within the hospital setting, the condition of patients that you see, I think it's enough motivation to make you want to try and do something that would help people, because it's a setting where
yeah, people continue.
It's actually a setting where both you and I sitting here know the reality of how difficult life is, how difficult sorting medical bills is. So I believe we that are in the front line, seeing what happens, get enough of motivation to actually try to do something. Maybe we just don't know how.
Yes.
But yes, I'm actually glad that your class, that's you that are immediate, have actually tried to come up with something.
Yes.
And I think it's enough motivation that even for us.
And I believe it was because of you,
even the motivation that came for us was our immediate seniors.
Okay, it's nice. Yes. Actually,
they were the ones that brought up the idea to us to actually start up this. So you see, like I told you, medical school is it's an ecosystem of its own.
Yes.
Where you, the person that is there, only understands what is actually happening there.
Yes.
So I think the motivation comes naturally. It's like an inborn thing.
Yes.
In this ecosystem.
That's, this is nice. I believe I can say from what you have just said, like the motivation is already looking at you.
Yes.
It's just that
for you.
We don't know how to really do it and all this kind of things.
Yes.
And most of us used to feel like we don't have what to give. And from what you have said, I can believe that you are trying to say that you don't have to have something. Just find a way that you can help out.
In the entrepreneurship lecture, one of the things they mentioned is social entrepreneurship, where the goal is not to actually make any profit out of it, but to solve a problem.
Yes, that's it. It's true. So thank you very much for that. Next, medical school is a hassle on its own, and trying to bring something into you while you are studying and doing other things is something else. So, please, we would like you to share some of your the strategies you use to balance the rigorous medical studies and your philanthropic efforts.
Okay. Well, like I said, the philanthropic work is not a one-man thing. It's been a collaboration from the society at large. So, being it something that is just not one person involved, it means that there's kind of a division of labor that happens. So the task is quite easier. But one thing I would like to point to at this point is, you see, in life, whatever you're doing, try and do what makes you happy.
Yes.
Despite the stress, despite the, commotions that happen in medical school, at least try and have something that would keep you busy. Well, let me digress a little bit again.
Okay.
Apart from the philanthropic, whatever, at the medical school, I also run a small business.
Wow. There's something we should have add into the topic.
Because it's actually about, okay, do what makes you happy at the end of the day. So I love baking. I love cooking.
I would like to cut you a little bit short. I'm a person that likes reading books.
Yes.
And I don't know if you've come across a book recently written by Ali Abdal. He called it Feel Good Productivity. He's trying to argue that for you to be actually productive, you even have to feel happy on the stuff.
Exactly.
So that's what you're trying to say.
Even if you notice that you do better in postings that you actually enjoy in medical school, you do better. So it's like, when one thing is not working, try and find what is going to give you pleasure.
Yes, it's true.
Yeah. So, and a lot of times I tell myself, this human brain it's in a box.
Yes.
thousands of neurons that you can make use of. The more you let them be, the more you don't brainstorm, the more you don't try to reason.
Yes.
You leave them dormant. And there are 1,001 things that you can do.
You can do. It's true. Seriously, I must confess, I can say you are really a specimen of a person that people will need to like really learn from with regards to medical school and life, because from what you are explaining, you are kind of getting the key of medical school itself. Like, you are not really like others that are complaining, oh my God, I'm not enjoying this, I'm just doing
No, we all complain, we all complain, but why keep complaining when you're not looking for solutions?
Yeah.
There's no point when you keep complaining and you're not trying to find a solution to your complaints.
It's true.
Yes.
So part of what we wanted to talk about in the topic, it's defining what success is. We would like to know your personal definition of success in the context of your medical career and philanthropy.
Okay. In terms of medical career, they always say the best doctor is the doctor that treats the patient, not the patient that knows. The doctor that knows the best.
Yeah.
So to me, success in medical school will be when I get into the working field and I'm able to offer something that would safeguard patients. Philanthropic-wise, success is, to me, I would say, is seeing other people happy and solving their problems, which ultimately, by solving people's problems, you make them happy. You put a smile on their faces.
It's true. Thank you for that. So, from our discussion, you have kind of like tell us a lot, and I'm sure you've already tell us how philanthropy is bringing fulfillment and success to you and so many people. And now, what I would like you to kind of tell us and tell me personally and audience is kind of like advice on telling us on how and why we should find our own path and our own definition of success, since, as they always say, success is not normally the same for everybody.
Yes, it's not. So you see, defining success should go as far as defining what you want to do and how it impacts you and other people at the end of the day. Say, for example, a thief that steals money from somebody, his success is at the end of the day he was able to steal that money from whoever, or a device or whatever he gets from a person. That is his own definition of success. But at the consequence of he has committed a sin and is likely to be reprimanded by the court or the law enforcement. So defining success, as much as it should be important to consider one's pleasure, it's equally important to consider the outcomes. And one should also ask themselves if at the end of the day, those actions of his, is he ready to deal with the consequences?
The consequences, true. Yes. So, thank you very much for this. And now, we would like to know some of your future aspiration post graduation, like in the medical field, especially since you're in the medical career.
Well, like I said, destiny brought me here. And I don't know what happens tomorrow.
Yeah.
Because, well, our lives are not in our hands.
Yes.
And it's not everything we decide for ourselves that always comes true. So, well, I would say whatever life offers, but career-wise, I feel like I'll do better as a surgeon.
Wow. Oh, personally, I would love you to be a physician, because you would have more time to do some philanthropy work. But since you said surgery,
well,
it's
like
nice.
I said, destiny, and the philanthropic work I've been doing, or I've been engaging myself in, it's not a one-man thing.
Yes.
So there will always be
people that cover up some other places. And
I feel like wherever you are, wherever you find yourself, helping people is one of the easiest things you can do.
Yes, it's true. That's nice. So, next, what are the practical tips that you can give with the students and considering a career, like just like you choose surgery? In choosing a career, what are the tips you can give us to consider?
Okay, so I think the SWOT analysis, that is the strengths, weakness, the opportunities and threats, are always important when trying to make evaluations for yourself in life. Strengths, you look at, okay, what can I do? What do I find easier to comprehend? What do I find easier to enjoy doing? You understand?
Mm-hmm.
So those are your strengths. Weaknesses, for somebody like me, I feel like I'm not the kind of person that can sit in one place for several hours talking to patients, consultations, whatever.
Oh.
So I feel like being a physician, and the way physicians, the way physicians arrive at diagnosis.
Yes.
All those put in differential diagnosis, rule in, rule out. Okay, it is this, it could be this, it could be that. I find them very cumbersome. But you see, surgery is a place where, okay, what is wrong with this patient? This patient presented with symptoms A, B, and C. Okay, it is most likely to be this. Just do this investigation. If it is this, okay, what is the next line of management to take this patient to theater? Or he doesn't need the surgery now. Or even the surgery come, okay, these are the options.
Yeah. So.
And opportunities, it has to do with the environment you find yourself in.
Yes.
Yeah. If it's an environment where they're needing more physicians, more public health physicians, where they're needing more psychiatrists, where you could find an opportunity and easily fit in.
Yes.
Then the threats also, okay. Like now, for example, the economic situation of the country is not quite favorable. And people are just the Japa syndrome. So it's actually a threat that maybe you want to work and there are not enough residents or not enough doctors, so you're going to end up having yourself overworked in certain fields. So all these things need to be put into consideration.
Yes.
Exactly.
So thank you very much for that. Now we come to the end of the program. So before we go, we'd like you to give us some of your final thoughts on importance of integrating medicine, philanthropy, and personal success.
Well, you see, healthcare is one thing that is actually a problem in Nigeria. So I feel like channeling help towards patients especially financial help, is something that would go a long way in improving quality of life for people. And it's something that you yourself, you feel fulfilled as a person. And one thing about these kind of things is you never know. Maybe you do something for someone, they say a prayer for you, and it follows you for the rest of your life.
Yeah. So thank you very much for those final thoughts. And I'd like to thank you so much for taking the time to be part of this. It's not easy. And I must commend that you are a humble and good person, which so many people have been saying. So let me just say thank you very much.
You're welcome.
We hope maybe in the future would have some, we also do medical revision series. Maybe would have you to come and revise some surgery-based course. As you said, surgery is what you like. Surgery-based course for us, which we can use and some other people can use. So
well, we already have a great mentor in that aspect. Dr. Bashir bin Yunus has been doing a wonderful job in putting medical students through exams, even the MDCN exams.
That's nice.
Yes.
That's nice. So thank you very much.
You're welcome. You're welcome. Thank you so much.